going to be hearing a little bit more on President Trump and his plans about health care. He is aligning himself now with the leadership on this measure that they say will be a big improvement over the Affordable Care Act that we now know as Obamacare. House Freedom Caucus Member Congressman Jim Jordan, Republican of Ohio, planning on introducing a different measure, though not quite convinced that the leadership measure is the way to go. Sir, very good to have you.
Good to be with you.
How big a gap and a difference is there between what you want to come up with, the alternative, to what the Republican leadership has already come up with?
Pretty big gap, Neil, because what we want to do is a clean repeal. Frankly, what we want to do is what we told the voters we were going to do and what they sent us here to do, and that is repeal Obamacare and then get into the debate about replacement. I'd like to do replacement as close to repeal as we can, but it should be a separate piece of legislation because, frankly, we don't agree on that yet. The leadership bill says, oh, we're going to repeal Obamacare, but we're going to keep a bunch of the Obamacare taxes. The leadership bill says we're going to repeal Obamacare, but we're going to keep Medicaid expansion and actually extend it out several years. And the leadership plan says we're going to repeal Obamacare, but we're also going to start this new entitlement for folks who don't have a tax liability. We're going to give them a refundable tax credit. That's not how it's supposed to work. So that's not what we told the voters we're going to do. So we're going to introduce a clean repeal. Senator Paul's going to introduce it on the Senate side. Let's do that much because that's what we told the voters we were going to do.
All right. Now, you do have some agreement with the approach they want to take on not only with the Affordable Care Act, but what your Republican leadership colleagues are looking at, and that is to cover pre-existing conditions, keeping your kids on a policy a little longer till age 26, I believe. So on some big issues you agree. What isn't clear is how you pay for yours. To be fair, it isn't very clear how the other side pays for its as well. But how do you pay for yours?
No, Neil, what I would argue is what we want to do is bring back affordable health insurance. That's the most important thing. Understand where we're at today. Fewer choices, higher costs, high premiums, high deductibles. For those working class families and middle class families who can afford the premiums, they can't afford the deductible. So we have forgotten in this country what a health care marketplace looks like. So let's do this. Let's repeal Obamacare, then put in place those policies that will bring back affordable insurance for working class and middle class families, like getting rid of all the mandated regulations and mandated coverages that are in Obamacare and encouraging market principles like health savings accounts, easy formation of association of health plans, interstate shopping for insurance. That's what has to happen if we're going to bring down costs. When you look at the bill that's been put forward by the leadership, I don't see how it does that. I think it's Obamacare in a different form. While slightly better than Obamacare, still is not substantive enough changes to bring down costs. That has to be our focus.
Then, have you guys talked this over with Speaker Ryan? The reason why I say it, Congressman, is that he's still, going full throttle on maybe as soon as next week, the week after, getting a vote on that measure. They're in a rush, but don't they risk doing what they criticize Nancy Pelosi for doing? Pass this thing and then read it. I mean, isn't that a rap that they had at the time?
Good point. I want to do it quickly, but I want to do it right. So the bill was introduced 36 hours ago, and they're marking it up in committee right now. I don't think that's what the American people want. I think they'd like to see it. And frankly, I think representatives who represent the American people would like a little more time to study this and have the hearings.
I could be wrong, but I think he's baiting, or the leadership is, and maybe President Trump applies some pressure here. Vote on this. We know it's not perfect, but do this for the team. What would you say in response to that?
Do it right and do what we said. Pretty simple principles. We make this job way too complicated, Neil. Our job is to do what we told the voters we're going to do. In my judgment, looking at the document, reading the document, this does not do what we told the voters we were going to do and what they elected us to do, what they sent us here to do, for goodness sake. We had an election in 2010, 2014, 2016 where this was a central issue, and every one of those times we said we were going to repeal it. So let's do a clean repeal, which is the bill I'm introducing today and Senator Paul is introducing today. Let's do a clean repeal, and then let's focus on those things we talked about that you and I know will actually bring down costs. I don't think this bill does it that we have in front of us, so let's change it.
Are you content with, in the end, seeing that whatever measure ultimately is approved, that fewer people will have health insurance? That it might be a million fewer, it might be, 10 million fewer, but the way things are going, with whatever Republican plan is ultimately decided on, that we won't have as many people covered. Not that that should exclusively be the goal, but that we won't have as many people covered under your plan, under their plan.
No, what I'm focused on is how bad it is now, and let's improve that. People may have coverage today, so-called coverage today, but can they really get care? Can they really get, is it
I
real
understand.
coverage?
So it's
when
not
they can't afford the deductible?
I'm sorry for badgering the same silly point, but it's not the issue of how many have coverage or don't have coverage. It's the quality of that coverage and whether it's affordable, right?
Of course. Think about the typical family out there, what Obamacare said to them. They said, we're going to have all these mandates, all these taxes, all these regulations, drove up the cost of insurance. They said, you have to buy it, and if you don't, you get penalized. That's the plan we're under now. We were told all kinds of false statements when they passed this thing. Like your plan, keep your plan. That whole, I call them the 9 lies of Obamacare, to pass this thing. Jonathan Gruber, who told us they lied to us. That's the context and framework we're in now. So the focus has to be getting rid of all that Obamacare that made this a disaster, and bringing back affordable insurance for all those hardworking families across this country who are looking at their premiums, looking at their deductibles, how they're going to afford it. That's what we have to bring back, is affordable health insurance. This bill, in my judgment, doesn't do it.
All right, now, if the measure that Speaker Ryan and the leadership came up with were to go to a vote right now in the House, Congressman, how many Republicans do you think would join you in rejecting it?
All I know is we had our House Freedom Caucus meeting last night, and there was strong opposition in that meeting. I don't think there are the votes there for it now. But look, this is the start, and this is why you have the legislative process. This is how American democracy is supposed to work. Let's have debates. Let's have amendments. Let's have discussion. Let's hash this out like we're supposed to in front of the American people with full amendments, so we can get to a much better product that I hope, in the end, will actually bring down the cost of insurance.
Congressman Jordan, thank you. Great seeing you again.
You bet. Thank you.